Good afternoon. Welcome to Calgary's TLC Laser Eye Centres. My name is Dorothy Ng, Regional Director for Vision Group Canada. We're pleased to host Health Minister Jason Copping, as well as our guests virtually and in person. I now invite Minister Copping to the podium to share the news with us today. Thank you.
Good afternoon, everyone, and thanks so much for joining me here today at the TLC Laser Eye Center. And I'd like to also thank Dr. Leckie and the staff, and to Dr. Francois Bélanger from AHS and our other guests. When we formed government back in 2019, we made Albertans a simple promise that every patient would get scheduled surgery in a clinical acceptable time. We started working to deliver on it, and then COVID-19 arrived in Alberta. So the timeline has gotten stretched out, but the goal has not changed. In fact, the work is well underway, and we're making real progress, as I'll talk about in a minute. The pandemic strained the system, and now, as we're recovering and learning to live with COVID, we need to address two lessons that we have learned so far. First, the system needs more capacity to deal with a crisis, whether that's a future variant or something else. We need to avoid the kind of disruption we've seen at several points over these past 2 years. But second, now that we're getting back to a new normal, we need to recognize that the normal we had before is not good enough. We need to do better, especially in the terms of access to care. Our system gives great care. It's second to none, but people wait far too long. That applies to a number of services across the whole system, but most of all, to scheduled surgery. We need to stop accepting that it's normal for patients to wait too long. That's not good enough for the individual patient, and it erodes confidence in our publicly funded health system overall. Our health system is based on a promise to all Albertans. The care you need will be there when you need it. Not someday, but when you need it. The Alberta Surgical Initiative is our commitment to renew our publicly funded health system by making that promise real, to give every patient their scheduled surgery within wait times recommended by medical experts. We're delivering on that commitment, and today I'm pleased to announce several developments and success. First, we're going to fund 25% more cataract surgeries and other eye procedures this year in chartered surgical facilities, including this clinic. AHS has finalized new contracts that will fund 35,000 eye surgeries a year compared to about 28,000 in the current contracts. That will drive wait times down and will increase the volume even further in future if we need to. We're building on the role that CSFs have had for decades to meet our goals for patients and for our healthcare system. A surgery provided under contract in a CSF is publicly funded healthcare, just like in a hospital. You don't have to get out your credit card to pay for it, and you get the same service you'd get in the hospital from the same surgeons according to the same clinical standards. But you get that care in a setting that specializes in it and doesn't have to meet all the other demands that a hospital does. So it's more convenient, it's more efficient, so the cost is lower. AHS harnessed the competitive market to reduce costs while also meeting the existing standards of care. And as more surgeries are performed in clinics like this one, capacity and space are freed up in hospitals to perform more complex surgeries, including complex cataract and retinal procedures, plus ear, nose, and throat surgeries. It is not one or the other. We need to maximize the roles of hospitals and clinics. And it's not just eye surgery. We need to do more surgeries across our entire system. But we know it's doable. This approach is already delivering results. During the pandemic, CSFs have kept on delivering as many surgeries as possible because they haven't been impacted by the demands on ICUs and on other inpatient units. In fact, 45,000 surgeries were performed in chartered surgical facilities between April 2020 and March 2021, more than ever before, and about 11% more than before the pandemic started. Cataracts are the biggest piece of that, and the results have been dramatic. In the past year, we've cut the median wait time for cataract removal by almost half. In the first 3 quarters of the current fiscal year, to December 31st, 2021, the median wait time was 10.1 weeks. The previous year, 2020-2021, it was 18.7 weeks. And the current wait time is shortest in 7 years, since 2014-2015. It really is a remarkable accomplishment. Cataracts are the largest component of our total surgery waiting list, and we just cut the wait time in half in the middle of the pandemic. We've gotten too used to accepting long wait times and thinking this kind of improvement is out of reach. And cataracts are the perfect example. Wait times increased every year from 2014 to 2020. By 2018-19, the median wait was 17 weeks, and wait times for other procedures were rising every year too. That's why we ran on getting wait times down, and that's why I'm standing here today. The current cataract wait time is a big turnaround, but we still need to do more. The nationally accepted goal for surgery is to be completed within 16 weeks. And in Alberta, some patients are still waiting twice that long. So even though the median has come down, not everyone is at that point yet, and we need to do more. And we need to make the same kind of improvement in other surgeries as well, which are more resource intensive. But now we see just how much we can do when we set a goal and mobilize the system to meet it. So to keep up this momentum and broaden it out to the whole system, I'm pleased to announce we've recruited a new surgical recovery lead. Ronan Seagrave is a Canadian healthcare leader with a wealth of experience in reviewing and strengthening surgical systems in BC, Manitoba, and Ontario, as well as in the UK. He's working very closely with my ministry staff and AHS to oversee, track progress, and advise on new measures we can take to transform our surgical system. So much good work is already underway, but Mr. Seagrave will challenge us to do even more. He'll start immediately on a project to apply a stronger patient-centered focus to the surgical wait list. We need people to spend less time waiting, but while they're waiting, we also want to give them better information and keep them involved in their care. We can do a better job of explaining the standards and what they can expect. We can work with them to manage their health to make sure they get the maximum benefit from surgery. And we can do more to make sure that surgery is the right option in the first place. It's not only the option or the best option for every patient. In fact, many patients are better served by physiotherapy or other rehabilitation services. It's about providing the right care to each patient. We need to be transparent and accountable about what we're doing and why we're doing it, to the individual patient and to the public. We'll be looking to Mr. Seagrave to help champion new ideas and drive them into practice across the whole surgical system to improve the patient journey from referral to post-surgery rehabilitation, to strengthen the workforce, and to boost surgical capacity to reduce wait times. So in conclusion, we are making progress, and we're going to do even better. We're going to recover from the pandemic, but we're going to do so much more than just get back to the normal that we had before. We're going to reset that normal where it should be to deliver on that promise at the heart of our health system, the care you need when you need it. Thank you, and I'll now welcome Ronan Seagrave to say a few words.
Well, thank you very much indeed, Minister Copping, for those great words, and good afternoon, everybody. And again, my thanks to leadership and staff here at TLC today for hosting us. As the Minister noted, I'm Ronan Seagrave, and I'm pleased and delighted to be here today to help explain how my role as Alberta's new independent surgical recovery lead will help move the province towards a more robust Made in Alberta recovery plan. A plan that will lead to a stronger surgical system that provides quality, timely surgical care to people and families. I've spent the last 2 decades supporting work to transform and strengthen health and surgical systems here in Canada, in Manitoba, BC and Ontario, and even further afield, as my accent is a giveaway, in the United Kingdom. I was chosen as the Alberta Surgical Recovery Lead because I can offer a unique perspective. independent, broad, so that firstly I can review, and I've already started work, in relation to all of the great work that's being done here in Alberta to improve the surgical system. But I'm also in a position to ask, what else? What else can Alberta do to provide surgeries and surgical care in better ways, designed around the needs of patients? As a healthcare executive, I've supported and advised on more than 30 operational reviews of surgical services and programs that have resulted in shorter surgical wait times and led to multi-million-dollar savings. They have fundamentally improved that patient journey towards, during, and after surgery, so patients move more quickly and seamlessly, and very importantly, have a better experience in the surgical system, no matter where they are on the pathway. This is the type of work I have the great pleasure in overseeing and will champion in Alberta, to create savings that, according to the government's plan, can be reinvested into the Alberta health system, to provide more publicly funded surgeries as quickly as possible to those, as the Minister referred to, who have been waiting the longest outside recommended wait times. We'll contact everyone on the wait list to check on their status and make sure that surgery is their best option. And again, building off the solid foundation of work that's already underway through the Alberta Surgical Initiative, we will set up a centralised electronic referral system for all surgical patients. This will ensure that they are referred to the most appropriate surgeon with the shortest wait time for surgery. We'll explore opportunities on how to keep our operating rooms open longer, to offer more surgeries and boost workforce capacity so we have enough specialised nurses and anaesthesia professionals with training to provide more surgeries. And very importantly, we will report back to Albertans on our actions and the progress, so that we're accountable to the promises that we've made to reduce wait times and improve access to the best surgical care possible. I can't tell you how excited I am and looking forward to this work, this really important work, and being a change agent for Albertans, so that now and in the future you will all have access to a world-class surgical system. My sincere thanks again to Minister Copping for leading the charge and setting the course to recovery. It's now my pleasure to introduce a gentleman I'm now getting to know very well. I'm now going to ask Dr. Francois Bellanger to say a few words on behalf of Alberta Services. Thank you all very much.
Thank you, Ronan, and hello, everybody. And thank you for inviting me to join today. It's really my pleasure to be here to talk about the work we're doing in partnership with Mr. Seagrave, Alberta Health, and the chartered surgical facilities such as TLC to improve the wait times of Albertans waiting for surgical procedures in our province. Patients and their families are at the center of everything we do and every decision we make at AHS. Therefore, timely access to surgeries is important to Albertans and to us at AHS. No one should have to wait longer than clinically recommended time for their surgery. We know that the pandemic has impacted every Albertan and every Canadian. We're really grateful for the patience of all Albertans who had their surgeries delayed as we took necessary steps to ensure our healthcare system was prepared to respond to COVID-19. We're working diligently to recover to the pre-pandemic surgical activity as soon as possible and to accelerate the implementation of the Alberta Surgical Initiative's a 5-step plan to improve surgery in Alberta. Taken together, the steps include strategies to manage capacity and improve collaboration with and support for specialists, primary care providers, and patients. The plan focuses on all phases of the patient journey, including the initial consultation with their family doctor and being referred to a surgeon, meeting with that surgeon for an assessment, preparation for surgery, receiving the surgical care, and recovering from surgery and returning to normal life. The third step of the plan includes improving access to surgery through expanded services such as in partnerships including chartered surgical facilities such as the TLC Laser Eye Centers. Patient safety and experience is always our top priority and was a key factor during the evaluation process. Each facility is required to be accredited by the College of Physician Surgeons of Alberta and to follow AHSN policies and practices to ensure Albertans continue to receive consistent, safe, and high-quality care. These contracts and other steps, including in the surgical improvement plan, will increase capacity for cataracts and other ophthalmological procedures, decrease the wait list, save costs, and ensure the healthcare system is sustainable both immediately and over the long term. In developing the plan, we received feedback from patient advisors, operational leaders, physicians, surgical teams, quality improvement programs, and primary care partners. While we were required to postpone surgeries to the pandemic to support capacity to care for patients who were ill with the virus, many successes from the surgical improvement plan have helped us recover from postponements. For example, by updating our provincial wait lists, a new process to confirm surgical status with patient wait lists in the Edmonton zone, we have improved by up to 11% our wait lists. A quarterly wait list review and scaling of this approach provincially is ongoing. Through the expansion of programs like Enhanced Recovery After Surgery and the National Surgical Quality Improvement Program, patients are going home earlier and there is continuous quality improvement in surgery. Provincial surgery data and analytics dashboards were developed to support detailed access, wait time tracking, and monitoring. Operating room hours have been increased at main surgical sites. In closing, we remain committed on reducing surgical wait times and continue to work through the province postponed surgery brought on by the pandemic. Working in partnership with Alberta Health and the chartered surgical facilities, we continue to move towards making sure patients and families will receive the surgery they need when they need it, according to clinical appropriate targets. Finally, I would like to thank all of the teams at AHS, physicians, surgeons, staff, nurses, and other providers who are working together to make sure this happens. We value all of you and your dedication to Albertans. Thank you for having me today. I will now pass the microphone to Dr. Leckie of the TLC Laser Centers. Thank you.
There we go. Good afternoon. Thank you, Dr. Belanger, Honourable Minister, colleagues from the press, and my fellow Albertan citizens. Thank you so much for giving me the opportunity to be here and speak to you all because we're very excited. Vision Group Canada is truly thrilled to be part of the Alberta Surgical Initiative. We know that Albertan citizens have endured long wait times. As an eye surgeon, I see this in my patients' faces every time I tell them that they're ready for surgery, but the wait for surgery could be up to 6 months. We have done great strides in improving these, but there's still a lot more that can be done. The government is also stretched at this time, dealing with the costs of the pandemic and facing a global recession. We need to be cognizant that we have to balance a tight budget, but still be able to perform important surgeries and provide care at the utmost gold standards. A bit about Vision Group Canada. Originally the brainchild of Dr. Mark Cohen and Avi Wallerstein, we're now a national company operating privately in all provinces, but publicly contracts like this in 5 other provinces. Over 100,000 eye surgeries are done nationally each year. Really, eye surgery is not just what we do, it's our passion, and we love it. We're kind of nerds and geeks about it. Eye surgery needs to be done in a safe, efficient, and cost-effective model. And remember, this is publicly funded cases. And really, involving ourselves into this sphere has been a really rewarding part of our core company. To be clear, though, we're talking about publicly funded surgery in a more cost-effective way safely for patients. By doing so, we hope to use the same budget and provide more to our Albertan citizens. I also want to mention that we're equally focused on patient safety, whether that's updating our sterilization processes, some that are actually used by other provinces as a benchmark for their own hospital care, to getting new equipment and constantly maintaining and updating our protocols. As much as I'd like to say that we're saving a lot of costs for the system, we're also for the patients. I'm really happy to say that any of our centers across the city, patients don't pay for parking, and we all know that can add up. I'd love to also say that this is my idea, but it's not. The last 25 years, we've been having cataract surgery done in chartered surgical facilities here in Calgary. And so what we're doing is we're streamlining it, making it more cost-effective amongst multiple centers. Gimbal Eye Center, LASIK MD, our flagship, and TLC, formerly known as Rocky Mountain House. These were originally established by pillars in our community, surgeons who really pushed forward the envelope. Gimbal Eye Center by Dr. Howard Gimbal, TLC, Rocky Mountain House by Dr. Thad Demong, and LASIK MD in Calgary by Dr. Richard Legier. And without their support and their dedication and building these centers, we wouldn't be where we are today. We're really just expanding on an existing practice and a legacy that has been given for us, and we're just trying to make it more available and accessible to public cases for all Albertans. We are committed to working with Alberta Health Services, the provincial government, and Albertan citizens, and all of the great surgeons that we have in the community, both in Calgary and in Edmonton, and expanding this relationship over the next decade. I look forward to working with everyone, and if anyone has any questions, I'd be more than happy to answer them. I think that concludes this portion of the session. And then once again, thank you very much for making Vision Group Canada a part of the Alberta Surgical Initiative and letting us help our fellow citizens. Thank you.
Thank you, Dr. Leckie. Thank you to our speakers. We now have a few minutes for question and answer. Operator, would you put the first caller through, please?
Jaylene Skolsky, CTV.
Hello, thank you so much for taking my question. It's actually unrelated to today's announcement, so I apologize for that, but it is for the minister. We are hearing concerns from emergency room doctors about long wait times and people walking away sick or injured only to return days later in worse condition. They call it a system in crisis, and they say they've invited you to come and tour the facility for yourself. I'm wondering if you'd consider that invite and what your government is doing to help reduce wait times in the emergency room.
Well, thanks so much for the question. I haven't actually officially seen the invite at this point in time, but happy to look at it at that point in time. I do, and his comments that we made earlier this week, we understand that in certain locations and for certain hospitals, the system is under strain. You know, a couple of hospitals in Edmonton here and here in Calgary. In terms of addressing that, we are investing in more resources to address that. You know, our whole budget approach, additional $600 million this year, and that's for the next 3 years, so a total $1.8 billion. But it's all about investing in greater capacity within our hospitals, and that includes people. Hiring people. Now, I appreciate this takes some time, but we're working very hard at that. But also, in terms of what's happening on the operational level, maybe I can ask Dr. Belanger to make a comment or two in terms of how we're managing the challenges we're seeing in some of the emergency departments in a couple of the hospitals. So, Dr. Belanger.
You know, the issue of overcrowding in emergency departments is something that's been ongoing for a long period of time. And it's a reflection of a system capacity. The analogy is that the emergency department reflects what's happening in the hospital and in the system. So it's really about, as the minister said, optimizing the investment so that we can improve our inpatient capacity, improve the number of ICU beds, for example, improve as well our continuing care capacity. There's additional continuing care capacity in the system that's being provided. That's really what's going to help the emergency department in terms of the number of beds that are occupied by patients that are required to be admitted. So that's really kind of at the forefront that we're trying to do. We do everything we do, obviously, to support our staff in emergency departments with improving the flow of those patients and making sure that they have the resources. There's a number of areas where we can do that to support and make it more efficient for patients who are waiting for admissions to be admitted in hospital, and free those beds, obviously, as I've mentioned, in the inpatient areas and also in the community. Thank you.
Thank you, Dr. Belanger. Jalen, do you have a follow-up?
I do have a follow-up in a slightly different topic. We're hearing some frustration from doctors wanting to prescribe Paxlovid, but patients aren't meeting the current eligibility criteria set out by the government. I'm wondering, when will the government consider making this treatment more widely available to anyone with a doctor's prescription? And if you could give a bit of background as well as the reason for the current criteria eligibility, if it's based on availability or what?
Yeah, so thanks so much for the question. We're actually assessing this issue right at this point in time. The reason why we had a tighter eligibility associated with it, because we had a limited amount of supply from the federal government. That has increased, and actually as a result of that, we've actually increased eligibility. And as I indicated earlier this week with, and Dr. Hinshaw, I think, spoke to that as well. If we get a sense right now, we're working with the federal government to see how secure that supply is on a go-forward basis, and assuming that it is secure, which I hope it is, and we're waiting for confirmation of that. Then we'll be able to look at changing our process. We're working on it right now, chatting with the doctors and with AHS to make that happen. Because in an ideal world, it would be the individual family doctors who could actually make, after the testing's done, make the prescription, and then they go right to the pharmacy to be able to do that. We're not quite there yet, but we're working on that, and part of it's going to be dependent on secure supply.
Thank you very much. Operator, can you put through our next caller?
Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. This is for the minister. The NDP has expressed a lot of skepticism or even hostility towards this surgical initiative plan. What is Alberta Health including in these new finalized contracts with private providers to guarantee taxpayers will be left on the hook with inordinate costs should these contracts be cancelled by an incoming NDP government?
Yeah, so I appreciate the question. In terms of the, I can, in terms of remark, it's curious as to why the NDP is taking has such a large problem with this approach, quite frankly, because 15% of surgeries under the NDP were done in chartered surgical facilities, and the reality is this is a this has been applied in Alberta, and as Dr. Leckie already mentioned, chartered surgical facilities, especially for these types of procedures, have been used and actually have proved very successful, particularly through, and I announced some of the metrics today, in terms of getting our wait times down during the pandemic. So this is a success story. This is a model that is working. Now we are entering into long-term contracts with these service providers, just like we had contracts with service providers under previous governments, and so we will. These contracts have provisions in there that we will provide volumes, minimum volumes for these service providers, and they need to be able to provide that service.
Thank you, Lisa. Do you have a follow-up?
Sure. I'm still not really clear what protections there are for taxpayers should these contracts be canceled, or how long these contracts are set to last. But I'm wondering if some of the Vision Group Canada representatives might also be able to speak to this. What were you looking for in these contracts to ensure your investments in hiring or facilities, should there be a change in government in the next election? And what did you achieve in these finalized contracts to address that?
So I'll start off, and then I'll maybe ask Dr. Belanger to talk more specifically about the contracts. But again, these are longer-term contracts, provide minimum volumes. So we're talking, for example, in Calgary, 15,000 cataract surgeries plus an additional 5,000 other surgeries. There is a cost savings for the Alberta taxpayer while maintaining the same high standards. Now, Dr. Belanger will speak more concerning the other items of the contract, but I'm quite hopeful that should there be another government that comes in, that they'll honor the contracts, because it's quite frankly it's in the best interest of our publicly funded system, and it's in the best interest of Albertans. It provides greater access to surgeries to get our wait times down, and it sets a lower cost, and it frees up space within our hospital system to do more complex surgeries, because as we said before, we need to increase our capacity of surgeries. The wait times are far too long, and this is about investing both in our charter surgical facilities and our public health facilities to be able to live up to that promise to Albertans. But with that, I'll ask Dr. Belanger to say a few more detailed words in regards to the contract provisions.
I think, as the minister has mentioned, AHS actually has quite a bit of experience with contracted surgical facilities. We've been doing this for a number of years. And so I think, it is publicly funded and privately delivered through a contract to AHS. So through a contracting, we ensure that the highest quality is maintained. Therefore, there's rigorous reporting that is required. Every physician, every surgeon that works in the chartered surgical facilities has to be appointed and privileged within the clinical departments within AHS, which means that they have to abide by the safety standards, the quality standards of that clinical department. They have to be able to manage the complications of their patients and be able to cover the acute care system that we have in our facilities. So I think that's central in terms of how we manage the quality in terms of the contract provisions. Clearly, in terms of how we proceeded with the procurement is really leveraging volume so that we can get better price, but we ensure through a contracting, again, that we maintain the highest quality and safety, the same as we do for every patient that's go through AHS. And, through our experience that we've had with chartered surgical facilities, in particular with ophthalmology here in Calgary, we actually have over a 10-year history of very successful management of cataract procedures and very safely and high quality for a patient with really optimal patient experience. Thank you.
Thank you, Dr. Belanger. Operator, can you let through our next caller, please?
Brittany Gervais, St. Albert Gazette.
Brittany, your
Hi,
line.
thanks for taking my question.
Go ahead, Brittany.
This is for the health minister. At the beginning of March, I believe Alberta had about 76,350 people on the wait list for surgeries and other procedures. Just wondering how many people are currently on the wait list now.
Thanks for the question. As of mid-April, the wait list is at 73,200.
Brittany, do you have a follow-up?
Hi, yes, thank you. So just wanted also to see if we could get an update. I think last month the province said that they were expecting to get around $200 million from the federal government to address procedures and surgeries put on hold. Wondering if the province has received that yet, and if you can detail the plan as to how the government's going to use that money.
Yeah, so I'll have to double check whether we've actually received that or not yet. We can get back to you on that. We had allocated $750 million in contingency funding to actually catch up on the backlog. So that $200 million will go towards that 750. But and part of the initiative, and this is the Alberta Surgical Initiative, and is focused on catch up, and then also getting wait times down. So that $200 plus the 750 that we've earmarked for both dealing with backlog and future COVID challenges and costs will be going towards that this year.
Thank you very much. Operator, can you let through our next caller, please?
Mirna Zuzkic, Radio Canada.
Hi, thanks for taking my question. It's for the minister. Last year, Minister Shandro set a goal of completing 345,000 surgeries province-wide during this fiscal year, or last fiscal year. So where are we at concerning this goal? Did we reach it, and how far away are we?
So I'll ask Dr. Belanger if he has the exact numbers in regards to that goal. I do know that we were impacted significantly by the fourth wave. We were given the impact that had, particularly on our ICUs, we had to shift resources. A lot of those resources were dedicated towards surgical recovery and performing surgeries. So we dropped to during some weeks just over 50% of normal surgical capacity, and our wait list grew. Now, and we hit it peaked at about 81,600 after Delta, and just by frame of reference, pre-COVID it was sitting at 68,000, which, don't get me wrong, is still far too high, but we peaked at 81,000. Now we're down to 73,200, and we're sitting at right now, even though we are managing through the current BA2 wave, we're still sitting well over 90% of our normal surgical capacity. But Dr. Belanger, I'll ask if he has the detailed numbers, but I can tell you, we are focused on getting the numbers up and through this initiative getting caught up on the backlog. Dr. Belanger?
So just in terms of first of all, the volume of surgeries that we accomplished pre-pandemic, and the baseline that we use is 18-19 is the 291,000 surgeries. And through the pandemic, obviously, we've had challenges in doing that. The accumulated total backlog is around 55,000, approximately 55,000, and we've actually performed a large portion of those surgeries back. So we've performed over 26,000 surgeries. Our backlog particularly from wave 4 and 5, is approximately 32,000. All of those surgeries have been rebooked, or most of those surgeries have been rebooked. And therefore, this year, obviously, we because of the pandemic, we are planning to do, or in 21-22, our total volume is 276,000 surgeries, and we're planning a large increase over the next year, partly through our contracted surgical facilities, to 335,000 to 345,000 surgeries over the next year. But that's our plan, so that we can catch up further and move into the Alberta Surgical Initiative. So a large part of the next year will be focused on recovery. We'll be working with Mr. Seagrave to try to accelerate the process in the department to do that, so that we can attain our goal and meet the targets of clinically appropriate targets. Thank you.
Thank you, Dr. Belanger. Myrna, do you have a follow-up question?
I do. I'm sorry if I missed it in what Dr. Belanger said, but I didn't hear the number, net number of surgeries performed in the last fiscal year, 21-22. And so, sorry if I missed it, but my follow-up would actually be about the eye surgery specifically, because even if wait time for cataract surgery province-wide has been reduced, in the North Zone in the last year, it went from 9 weeks to 33 weeks, and other kinds of eye surgeries have also seen increases in wait time during the last year. And this is despite the fact that more surgeries have been performed by chartered facilities than they have before. So to the Minister, can you explain that and why you still think that chartered facilities will help accelerate it in the long term?
Yeah, so maybe I can take that on. The total number of ophthalmological procedures is around 42,000. So approximately 30,000 would be done in chartered surgical facilities, which are cataract procedures, 5,000 are non-cataract procedures that would be performed, and then there's an additional 7,000 that are performed in AHS because of the complexity of the patients and some of the areas in rural Alberta. So that's what you're looking at in terms of the volume. we've made significant improvements in our wait times because there's been increase in volumes over the past year, and because we've actually, as mentioned in my introduction, in that we've actually looked at the way that we've looked at our wait lists, and we've looked at how people are prioritizing the wait list. And we've also looked at the allocation process in terms of how the surgeries are located so that they actually located to the surgeons with the shorter wait list. So that has made significant improvement in that wait list in Alberta. Again, our commitment on the cataracts is to meet those clinical appropriate targets as soon as we can. And we anticipate that we will be able to do that in 2023, and that's our goal in terms of the cataract procedures. Last year, I have to get back in terms of the exact total number for last year. Of all surgeries last year, so in 21-22, the total number of surgeries approximately 276,000 surgeries. Thank you.
Okay, thank you. We have time for one more question. Operator, will you let through our final caller?
Sarah Comedina, Global News.
Hi, thank you for taking my question. This is for the minister. I know you mentioned you're not sure if you received the federal funding yet, but when that does happen, I'm wondering what are the plans to use that money for when it comes to backlog?
Yeah, so we'll use that funding for through AHS to be able to perform our SMB, because we look at surgeries, it goes through both part of those budgets to actually catch up on surgeries, right? So our objective here, as indicated by Dr. Belanger, is to catch up on the surgeries, and then start working down the wait list times. As indicated already, we are not going to, our objective initially when we came into to office was to be able to bring all wait times within clinically regulated times by the end of this government fiscal year, by the spring of next year. We're not going to get there. COVID has impacted our ability to do that, but we are going to make some meaningful progress on that. As Dr. Belanger indicated, we're ramping up capacity through the ASI and leveraging chartered surgical facilities, which also expands capacity to be able to perform more surgeries within our hospitals. And then Mr. Seagrave, one of his key deliverables is going to be, okay, how do we actually speed that up even more? And the $200 million will be going against the backlog, and we also, as I previously indicated, have earmarked in the budget $750 million to deal with the backlog, as well as contingency fund for whatever this fiscal year COVID might bring.
Thank you, Sarah. Do you have a follow-up?
Yes, I do. So when it comes to, when we were talking to the NDP earlier, they mentioned ways, instead of going to charter facilities, as maybe looking at recruitment. I'm just wondering if there are, what your thoughts on that is, and if there are any plans to look at recruiting more physicians and surgeons to come to the province to help with this backlog, or if that would work.
Yeah, so I don't know the exact suggestions made by the New Democrats, so I can't speak specifically to that. I can tell you that we fully recognize that there are challenges in regards to healthcare professionals, particularly in rural Alberta. As part of our budget, we're dedicating $90 million to be able to support both retain and then also attract through various training programs, locum programs, a reside program, physicians in rural Alberta. We're also in conversations with my colleague, the Minister of Advanced Education, in regards to how do we focus on our own programs within with our fantastic post-secondary institutions, our medical schools at U of A, U of C, to be able to graduate more doctors and get them into rural Alberta in the areas where they need them. Anesthesiology and family physicians are two of the big areas. And then also working with my colleague, the Minister of Labour and Immigration, in regards to welcoming more physicians, foreign trained physicians, and then working with the CPSA to actually accredit them faster and further streamline that process to get them working here. So all of that is on the table, and we are going to be focused on, we put money behind that, and we're going to be focused on attracting and retaining not only doctors but other healthcare professionals to be able to deliver services that Albertans need, particularly in rural Alberta.
Thank you very much, Minister Copping. Thank you to our participants today. That concludes our press conference.
Thanks,
Have a
everyone.
great day.